Well, well-known faces like the late host of Jeopardy, Alex Trebek, singer Aretha Franklin, actor Patrick Swayze, all of them died from what is known as a silent killer cancer. It's a scary cancer because it doesn't usually have those early symptoms, but there are some ways that you can eventually take protective measures for this. We're getting some more answers on this today is Dr. Omid Moven with LSU LCMC Health Cancer Center to answer some of those questions. And we thank you so much for coming in. Appreciate it.
Thanks for having me. Glad to be here.
It's sad because, you remember all of these high profile faces that put a face to this deadly cancer because not many people are familiar with it. What causes pancreatic cancer? What is it doing to your body?
Pancreatic cancer is, like you mentioned, is one of those diseases that considered among the more deadlier diseases. And there are multiple factors that can cause you to have pancreatic cancer. It has been widely studied aside from the genetic factors. Factors like smoking, history of smoking, heavy drinking. There are some associations between diabetes and pancreatic cancer. These are the multiple causes that have been associated with pancreatic cancer. But in general, there's still a lot we don't know. But the modifiable factors that we talk more about is mainly these factors, the environmental factors such as smoking and elevated weight and diabetes.
So if there are not a lot of early symptoms then, so people may say, well, how am I supposed to know? I have no chance of getting this. Are there some signs that you can catch it in time?
Yes, the problem with pancreatic cancer is it's generally diagnosed at late stages, and that's why it's called silent disease. There are some signs and symptoms. The problem is they're very nonspecific, and abdominal pain, fatigue, unexplained weight loss. These are things that can happen in our daily lives, right? But they can be a sign of pancreatic cancer as well. But then there are more disease-specific signs and symptoms as well, such as jaundice, which can happen in about half of the patients, or a pain, a specific pattern of abdominal pain, such as the pain that radiates towards your back, or even dark urine, stuff like that. So there are some symptoms and signs that are more directed toward pancreatic cancer, but generally it's mainly the vague and non-specific symptoms that you really need to pay more attention towards.
And as we look at the pictures of Alex Trebek that we see on our screen, Aretha Franklin, the late actor Patrick Swayze, I mean, these are well-known people, and when you saw the pictures of them and what it did to their bodies, it's just so sad and heartbreaking. There's local research that's happening, right? What are you guys doing? How can people participate? Tell me about that.
Yeah, so at our center, the LSU LCMC Cancer Center, we try to provide a holistic approach towards patients with pancreatic cancer. It's not only treating the disease per se, but it also providing a whole multidisciplinary approach to provide care from every aspect. It starts from providing access to care to everybody, not only those who can have access through their wealth. But beyond that, it's providing approaches that approach other disciplines, such as your nutritional status, your performance status, the psychosocial support, in addition to the actual treatment of cancer. And beyond that, there are studies, clinical trials that we offer to the patients. Can
people participate locally, and how can they?
The patient can participate, and there's a number that hopefully it's going to be shown in your.
We have the number. We're going to
hopefully put it on
to participate, right? Because you're trying to figure out how to fight this pancreatic cancer.
And it's very important because we all talk about how this disease is so hard to treat, and every knowledge about cancer is generated towards all these studies that we participate on. And we enroll all the patients. All they need to do is just come to us, and whatever we have to offer, we can discuss all the available studies, that we have several of them, to the patients, and we evaluate if they're eligible for the studies or not, and we facilitate their participation. So it's just, as their part, it's just willing to be participating, and we facilitate everything else.
Thank you so much. We just showed the number there on our screen to participate in the trial. So this, but most importantly, based on the symptoms you tell us, if you feel something's off, go to the doctor before it's too late. Appreciate you coming in. Thank you so much, Doctor.
Thanks for having me.
Thank you. Well, you're